I'm Dr. Green with Seaview Orthopaedics. I'm an orthopedic surgeon that specializes in disorders of the foot and ankle. Plantar fasciitis is a very common condition in the foot and ankle. Plantar fasciitis is an overuse injury which causes tearing of the plantar fascia. The plantar fascia is a piece of tissue that runs from the tip of the big toe and inserts onto the heel bone. Plantar fasciitis has a very consistent set of symptoms. People generally complain of first step in the morning pain. So that first couple of steps you take once you get out of bed, once you get out of a long car from a long car ride, once you get up from sitting and working at a desk, you'll have heel pain. Characteristically, symptoms subside in the middle of the day and get worse at night and very bad in the morning as well. So there are definitely factors that can predispose you to having plantar fasciitis. People with tight heel cords, that is tight Achilles complexes, tight gastroc complexes, which are all the muscles in the back of the leg. People who aren't flexible tend to be predisposed to. Again, people that do a lot of activity who tend to walk more than 10,000 steps per day, typically seen in mail carriers, delivery people, just because they're on their feet so much. So plantar fasciitis has a ton of treatment options. The condition is generally thought to be self-limited, that is, it goes away in time. The problem with that is it can take 18 months to be self-limited or go away in time. From a non-operative perspective, what we generally do is we start people on an anti-inflammatory, either an oral NSAID, oral ibuprofen, Motrin, Aleve, or a topical version of that, as there are topical versions of those medications. We generally get people into a night splint, which will stretch their foot out during the night when they sleep. We will generally get people into silicone gel heel cups, which are little cushions that go on the back of the shoe. That gives you a little bit more squish. We generally do physical therapy, focusing on stretching modalities such as Graston, which is essentially manual massage with instruments to break up scar tissue at the plantar fascia, as well as stretching exercises, especially if you do have tight Achilles or tight hamstrings or heel cords. If those modalities or those treatment options really don't work, you're looking at more quasi-interventional or almost surgical management. That includes numbing the foot and using an invasive device that can do a tenotomy or actually cut the plantar fascia just through a little stab incision. This can be done in the office or done in a surgery set. We can also use augments such as amniotic allograft or platelet-rich plasma, PRP, which are essentially stem cell treatments. If all of that fails, there is an open surgery that will deal with all the problems associated and take care of plantar fasciitis pain. So plantar fasciitis can be prevented in several ways. One, always make sure you're wearing appropriate cushioned shoe wear. That'll prevent the plantar fascia from being damaged. Really try to keep a normal step count during your day, not do excessive or extreme activity. Also, if you happen to have tight hamstrings, tight Achilles, make sure you get yourself involved in a good stretching program to prevent the development of plantar fasciitis and other pathologies or other problems that can develop. People should see a doctor about their heel pain when it's present for about a week or two and is not getting any better, and if anything, getting worse, so that they don't have to suffer and live in pain, because it's a condition that can easily be treated.